Wow. So a lot of physical stress, a lot of mental, cognitive stress. So prolonged duress within your internship residency program. And what was your mindset? What was your self-talk? It sounds like you started recognizing those symptoms, but was it initially, oh, I'm in burnout? Or was there something you kept telling yourself to endure the prolonged stress?
I absolutely did not know it was burnout. I had no idea. I actually didn't know burnout existed until, gosh, it must have been 10 or 15 years after I left practice. Um, what I said back then was I looked around, and this was before there was any discussion of burnout or physician wellness or anything like that. But I looked around at my colleagues, my peers, and I said, well, they all look like they're doing fine. What's wrong with
Mm.
me? Why am I having so much trouble? And I didn't have an answer for that except you must be weak, Diane. It must be something about you that you can't hack it. And so I carry that sense of, I should be able to do this. I should be able to work 110 hours and not have it affect me and be completely, uh, fresh and have my thinking be just fine and not have these memory problems about zip codes. So I was consistently telling myself I should be able to do this. And it, like I said, I didn't know it was burnout. I didn't realize until years later when I came across the definition of professional burnout, and I thought, oh my gosh, there is a
Mhm.
name for what I experienced.
So
That's really
you started out
interesting. Oh, go ahead,
overstressed
Brian.
and you went to disillusioned and then you became slightly disengaged. And was there a point where you became apathetic before you decided to leave, or did you catch yourself before that time?
Oh, apathetic. I think I caught myself, and I wouldn't say that was anything brilliant that I did. It was more what happened was the worst of the burnout was during training. Those hours and just the level of stress and the increasing responsibility and feeling each time, like when you progressed from medical student to intern and intern to second year resident and second year to third year resident, each time you felt like I don't know if I'm ready for this. And that's a bit of imposter syndrome, but it's also a bit of there's a huge leap on each of those transitions in terms of your responsibility. And so that was very stressful. When I finally went into practice and I practiced for somewhere under 4 years, um, it wasn't as bad. The physical symptoms weren't as bad. I had more sleep than I'd had before. My memories started to be normal. Um, but when I looked ahead, I kept looking for a way to carve out a life in clinical medicine where I could have a full life and not burn out again. And when I was in training, I was not married. I A relationship that I'd had, a long-term relationship, broke up at the beginning of my internship year. So I was single and I didn't have children. I didn't own a house. I had no other responsibilities. And I thought, how in the world am I going to have a life and have these things that I want in my life and not burn out again? And I didn't see a
Mm.
way. Now, I didn't ask for help. I didn't know about help. I didn't talk to people about it because I had that level of shame about why would I talk about this? Why would I admit to people that I'm struggling? And so for me, it was looking ahead and seeing I can't figure out how to navigate this without having this happen again. And so I think I need to leave. It wasn't really well thought out, um, but I would say it did take me several years to get to the point of saying, I just need to leave. I don't know what else to do, but this is not working.
And Diane, you walked through very detailed thought process and burnout symptoms. Did you have coping strategy to deal with stress at that time, or was there simply no time?
Mm. Well, during medical school, I would run and would run with some of my classmates. I trained in Philadelphia, and it was a really wonderful place to run. That the traffic lights were timed so that if you kept up a certain pace, you could run all the way down to the river and back in one swoop. And so that exercise was huge. I also have always read for pleasure, and that was a really good release for me. In terms of anything else, not really. And what happened was when I got to that internship year, I saw myself just shedding parts of me, my identity. So I stopped exercising. I stopped reading for pleasure, which I literally had done my whole life every night since I learned to read. I broke up with that in that relationship with that long-term boyfriend. I had less contact with family and friends. I had moved to Boston where I knew no one. And so I was really, like I said, shedding parts of myself to just try to keep up with the workload. And so, in terms of kind of who I was and where I was, I didn't know. I think I was almost like becoming a machine, and I thought a machine is the only way you can do this. You can't feel, you can't have physical needs, you can't have like emotional needs. You just have to push through and do this. So I'd say I had some coping mechanisms, but then I like let them go, and didn't really pursue anything that would have been helpful to me.